that likes to talk benefits for 30 or 40 minutes straight without any interruption. So I don't want to go over my line, but if there's a direction that people would like to go, we would love to get some interaction. It makes it a lot more fun. And obviously, I'm here to hopefully answer some questions or hit on some things that everyone in the room is interested in. So again, just want to thank Summer, thank Teresa, and the whole higher level team for giving us this opportunity. We have had many years of partnership, and it has been very successful, so we appreciate that as well. We really feel that we're best able to serve our clients by focusing on our area of expertise. That is the employee benefits, the insurance components, and all the pieces that go around the insurance. And really, we're allowed to do that because we have partners like Higher Level that bring expertise to all of the many other pieces that you all have to deal with on a daily basis, from payroll to HR to compliance, recruiting, all of the things that are on your plate. The benefits, I know, is just one piece of that puzzle for all of the owners and operators and administrators that are on the call today. So again, we are able to focus on the piece that we are passionate about because there's somebody else that can help with all those other pieces. As Summer said, my name is Joe Bottani. I'm the president of Arch Brokerage. I've been doing this for over 20 years as a benefit advisor. Our firm has been around over 50 years doing this. I'm also the managing member of the Blue Chip Consortium. That is a group of 11 independent benefit firms that combine for negotiating power with not only the insurance companies, but also the technologies that we bring to the table, and just a collective, greater 11 heads better than one mastermind group. Combined, we are the largest benefit broker in the St. Louis area. We manage the benefits for hundreds, not quite 1,000 employer groups. And so we have quite a bit of experience in this area, and that is really what my focus will be today, is on those solutions, the conversations that we're having with employers on a daily basis, and what we are seeing from not only them, but their employees as to what is important. What is moving the needle when it comes to benefits? It is obviously going to touch several other things, so I will touch on some things. I know benefits are going to touch payroll directly. I think they touch recruiting and retention both directly and indirectly. And then there's compliance, and then one of the things I'll focus quite a bit on is communication. So think about internal marketing to your team. How do we communicate these benefits? That's a really important piece of the value that you're going to get, or the return on investment you're going to get from the dollars that you're spending on benefits. I like to kind of start off with our philosophy. I think it's fairly simple, and I tend to joke, but I think it's true that we are probably the only people in any room that we're in that are in the business to provide benefits to employees. Everyone else is doing it because they really have to either recruit and retain people, or to comply with the laws, the Affordable Care Act laws, depending on your size, or maybe by contract, because that's the agreement you have with employees or unions. For all of the employers that we work with, we want the benefits that they're providing to complement rather than distract their true business mission, their why. If you read Simon Sinek or listen to his talks, we want to allow them to recruit and retain, promote all of the talent they need to grow their organization and accomplish their true purpose. Because again, I know that benefits are a piece that is a need to or have to, not the end goal. And so our whole purpose and our mission is to align the benefit plan with the mission and purpose of the company that we are working with. So we'll come back to that a little at the end, but I wanted to start with that as well. One of the things that we're going to focus on today is the reality that is being kind of forced upon all of us in this world. There is a constant pull between trying to simplifying the value and the cost and the administration, trying to weigh those things out. Not the value being what the employee perceives and how they feel about the benefit plan, the cost being obviously the hard financial piece, and then the burden of the administration that comes along with these plans. And then how we can try to bring some benefits and solutions to the table to try to maximize those things, maximize the value, minimize the costs, and ease the administration. A lot of that's going to rely on technology. We're going to talk through some of the different technology systems that are available. But my real goal is to give you kind of a list of things to be thinking about or questions to be asking that you can act on at the end of this conversation. That would kind of focus on what's being offered, how it's being communicated, and then how it's being delivered, how it's being implemented. So think about the strategy as far as what benefits are being offered, the communication being how it's marketed internally again, and the delivery is the actual where the rubber meets the road, how those things are going to get put in place, employees are going to be signed up, and at the end of the day, that's going to result in a card, a protection, and the appropriate payroll deduction on the backside. Now, I realize that there is a tremendous amount of pull in every direction at the HR role. It is not just in the benefits section, but sector, but all of these other things we talked about you're dealing with. Just in the benefits alone, I think there is a continual rising expectation. And so employees are seeing how the experience is in the rest of the economy. Think the Amazon experience of the world, where I can buy something on my phone in a matter of seconds and it might get there by lunch. I can have groceries delivered within an hour, and just the kind of the immediate satisfaction. I am in no disillusion that health insurance specifically, and insurance in general, does not have that same experience. And so the expectation is very high, and the person that those employees are coming to with their expectations is typically you all. The cost pressure is intense. We are dealing in an environment, inflation across the economy, but that is doubled or even tripled in the healthcare sector. And so I'm sure I am not surprising anybody by telling you that the healthcare costs are continually adding pressure to all budgets. It is across the size. We work with companies of several hundreds of lives down to a few. And the conversation is the same. This is growing faster than any other expense, and usually faster than revenue. And so controlling the cost is something we're gonna talk about extensively here. We want these benefits, though, to reduce workload, not add to it, and that is not typically what we're seeing. We're seeing that the benefits is taking up a bigger chunk of the time that you all have to do all of these other tasks. And then you're supposed to be the expert not only in benefits, but in all of these other areas of payroll and compliance and personnel management and promotion and recruitment. And so you become the chief problem solver a lot of times, instead of being able to really be consultative. And so this is the issue that we're dealing with. This is the problem. I just wanted to add a few things that I see that are kind of off of this. I mean, obviously the healthcare cost, we're going to talk about some of the reasons why that is the way it is. But drug costs, specialty drugs, the GLP weight loss drugs, those are things that are compounding this cost pressure. I think just outside of benefits, there is a real pull for compensation demand. As inflation continues to increase, we've got a lot of increasing minimum wages across the country. The remote, everyone went to remote. Everyone's now, maybe coming back to the office, or return to work mandates, or some kind of remote work hybrid. Those are all demands that are placed on you for hiring, and so the hiring and recruiting is more complicated than ever. And then I think the employees' situation is more complicated than ever. There is a real true burnout issue where because of some of that remote work and work from home and mobility, there is kind of a 24/7 working environment. I think there's a skill gap and a accelerated demand with AI and all of the pieces that brings to the workforce. And I think those combined with a real mental health struggle. And so we'll talk about some of the mental health issues that employees need in the benefit plan. that relates to not only just coverage but access, getting to mental health providers. And then the last thing that we've been talking about for years, and now we're seeing it really kind of expand, is the multi-generational workforce. There is 4 or 5 generations, depending on who you read, in the workforce at any given time, and their demands, their needs, and their wants are very, very different. And so the big theme that we'll talk about today is this idea of customization, of creating benefits and opportunities for people that are customized to their needs and their wants, but at the same time maintaining some level of simplicity. And that, to me, is this big balance that we are all struggling with, and especially in the benefit world. How do we customize things? How do we control cost? How do we get really individualized and also keep things simple so that they're understandable, workable, and not frustrating? So I pulled together several reports and benchmark studies we have access to. I'm happy to share any of those. We have hundreds of pages of research that available to us, that is talks about the employee surveys. There's a couple famous ones that are done every year. We have subscribed to one that is more for our size market, for that 10 to 500 life group size. And really the themes are very similar, and they have been, but people value probably medical coverage as the number one benefit. That is obviously the one that sucks up the most oxygen. But diving a little deeper into that, they really want predictable out-of-pocket costs. They want to know what they're going to pay. And so that is, the medical coverage is key, but knowing what your risk is, knowing what you're going to pay is really important. And that starts to already go into that communication bucket. The prescription affordability is usually right up there. Again, it's usually embedded with the medical plan. Sometimes on a self-funded plan, it's going to be broken out. But the prescription is one of the biggest drivers in the healthcare cost. It's also the fastest increasing component of the employee's spend. And so obviously that's a place where they're going to have a large value and want the best coverage they can get. From there, we talk about the mental health piece and virtual care. Again, this is not so much even around anymore the coverage and the copays and things. It's about getting access, about being able to see providers and getting their needs met. So I think access is becoming the piece that we're hearing the most about on prescription, mental health, and then also when we get into dental and vision. Those two being like the next 2 benefits that are most valued. And then paid time off and flexibility. And included in flexibility is that work from home piece. That is one of the most valued benefits in the market today. And obviously changes by industry. Some industries don't have that flexibility, but ones that do, it is almost kind of a prerequisite. For as far as how high it ranks up. It ranks above several things that I'll talk through. So what I was most interested about this slide in doing the research was the things that are not on the list. The things that I think about from a financial planning standpoint, or from a big dollar protection standpoint, did not make the top list. And those are things like 401k, life insurance, disability insurance, like long-term disability. And so, digging into why these things are the most valued, and why those things are a little less valued, is some of the utilization. These are things you see and use and touch on a regular basis. And so you think about prescription drugs, often you're filling those every month. Dental benefits, you might use twice or more times a year. Vision is an every year benefit. The PTO is ongoing. That's something that pops up, not only, whether that's sick pay or vacation or combinations. Those are things that people are looking at on their paychecks. They're logging in to see what their balance is on a daily basis, as opposed to 401k, where they might check it on an annual basis. When you get into life insurance and disability, those are some of the biggest, most important things you can do to protect your financial future. I mean, you're protecting all the future income you have, but people don't see it. and it's a long way off or a never event, as opposed to a daily, annual or even monthly event. So where we want to focus today is kind of increasing the value on those highly used benefits. And a big piece of that is reducing the friction to access. And so if people can get to the dentist they want to get to, if they can get to a mental health care provider now and not in a few months, that is going to drive up the value that employees are placing on their plan. And so I think, again, affordability is key. Good coverage is important, but access and being often utilized is just as important. A few questions that came out of those surveys as far as what employees ask the most questions to you all about on the plans. Which plan is best? Why is this so expensive? Is my doctor in network? Why did my prescription cost change? Who do I call? And really all of this results in confusion being the biggest driver of dissatisfaction. And so there is a piece that no matter how good the coverage is, the perceived value of the coverage is going to really drive the satisfaction level. I think we've kind of gone almost in a full circle where we were going to multiple plan options. The more plan options, the more choice, the better. The more customized we could get, the better. But some of the things that we're hearing here are counter to that. And so the idea here is really, how can we make this simpler? The plan design simpler. How do we get information to people so that they can handle some of their own questions, as opposed to creating a bottleneck in each of your seats? And so self-service to some of these answers is key, as well as a simpler plan design and some tools that help people make educated decisions. I think some of this also comes from just the nature of the cost. So we have, created an environment where high deductibles are the norm. And so we have more risk on the plate of the employees, but not necessarily more information. And so one of the big things that we're talking about today is tools that help people navigate this system. So think about drug programs, where to find not only why did my prescription drug cost change, but how do I find my drug at the lowest cost? Is it through a different pharmacy? Is it through a different vendor? Are there programs that can help with drug costs? And then when we get into the medical side, the physician and the facility side, people, again, if you have a high deductible plan, whether that's an HSA or health savings account plan or a traditional copay plan with a high deductible, you have some real skin in the game. And when you tell people that they have to pay $3,000, $4,000, $5,000 for a surgery, not giving them the information to compare what the costs are across different physicians, different facilities, or for different procedures is really kind of a disservice. So we're giving people some financial risk without giving them all the tools they need to make good decisions. And so again, I think we're trying to balance, the cost with the experience, and then also the customization with the simplicity. One thing I like to talk about is that you could have the best plan in the world. We can benchmark your plan. We can put it next to thousands of other plans and tell you that, you're in the 99th percentile for benefits. If your employees don't understand it, they will not think it is a great benefit plan. The same spectrum is true on the other side. You could have a fairly basic plan that is really well educated and people understand it and they are used to it and they know how to navigate it, and they might think it's a really great benefit plan. So I say that, education will drive the perceived value, and the perceived value is really the true value, or in your eyes, the return on investment on the benefit dollars. And so one way to get a better return right out of the gate is to create a better educated workforce. And so a few tools that we talk about here are decision support tools. So that is really kind of a easy to understand comparison. And so there's a variety of these ways to do this. You could do this in an Excel or in a PowerPoint or in employee meetings. You can do it in video. You can do it with a with a technology solution, but we want employees to be able to compare what's important to them and understand the differences between plans without taking one-on-one time from each of you. There's I mean, the world that we're kind of seeing unfold right now is kind of wild, but what used to be something that took maybe a designer to generate, or would have to be mass produced, like infographics. Those can be created almost instantly using different AI tools. Video content is probably the way that most consumers, especially when you get to those younger generations, are consuming information anyway. So think about reels, short snippets of video. If you want to explain what a HSA plan is, putting it in a 4-page document versus a 45-second video is going to be a very different experience for a lot of those individuals. One of the things that we started doing during COVID, really, in that work from home environment, and have just continued and probably will not stop, is virtual enrollment meetings, as opposed to sitting around a table or trying to get people off of the floor in a manufacturing environment, but then recording them. And so we are essentially recording enrollment meetings, and the idea there being is, one, you don't necessarily care about the information until you need to care. So you don't really worry about your emergency room copay until you've got a sick kid and you need to go to the emergency room. But also the people that are in the room, a lot of times, if we pulled somebody off the floor at a manufacturer, they are probably not the people that are taking the kids to the doctor when they have a ear infection. And so getting the video out to all of the members, not just the employees, is really beneficial. And then again, having it there for the year. So whether that's when you need it later in the year, or when you get a new hire, they're getting the same message that everybody got at open enrollment, instead of the best that was available on Monday morning when they started, and you have 10 other fires going on. And so that's really kind of a real simple solution. Again, I think where AI is going is pretty exciting, where anybody can basically take some summary of benefits and create a real workable infographic with a little short video snippet of the differences between two plans. Truly kind of remarkable. All of these, though, are going to address these issues. So people are going to understand their benefits better. We're going to decrease frustration, decrease workload. And at the end of the day, what we're really doing is we're driving up the value of the dollars spent, simple, without spending more, without changing the design. It's just a matter of the communication. I'm going to hit on cost for the next couple slides. Been in enough meetings recently that I know that the cost of benefits is unsustainable. That is to say the least. And so what we need to kind of take a little step back about is what the benefit cost is going towards. How can we address it? And what happens when we shrink cost one place? I do think it pops out somewhere else. It's like squeezing a balloon. If you control cost by restricting access to providers, for example, you go to a narrow network, that's going to pop out somewhere else in the form of some frustration. Some employees are going to say, hey, I don't like this. I can't go to the doctor that I want to see. And so there's a real ebb and flow here between controlling cost and the ROI. So the lowest cost doesn't result in the greatest ROI. We have to balance those things. It can create more issues. As we lower cost, we tend to have to peel back some access at some place for some people. And by doing that, we are going to create some issue. The dissatisfaction drives calls to you. People come to your office. It's going to increase workload. And then again, that perceived value, if people don't think that they have good benefits because now they can't go see the doctor they're used to seeing, that does impact retention over time. It impacts morale. My employer doesn't pay for the good insurance. We have to go to this provider, or we can't get these drugs because we're on a different kind of drug plan than my neighbor is. And so you have to also factor in some of that time, your time on the ROI. So we talk about the cost of plan, the cost to administer the plan, and then the cost of confusion is really what drives the return on investment. And so a lot of times the cheapest sticker price can drive the highest administration load and really look cheaper than it is. It's a false economy. You're adding cost in other areas, even though that is not the intent. One of the things we are going to drill in on, and this was kind of added, that I think we have to address the cost and where the dollars are going in the benefit. I would say that this is probably a whole nother presentation, but I want to just give you an overview. It's all about cost containment strategies. We are seeing these being promoted. You know, if you get on LinkedIn and you know any benefit brokers out there, they're talking about all the places they can help you save money on your benefits. And I'm a big supporter of cost containment. I think it is needed. We can't just keep paying 15% more every year for decades. And to control the cost of the insurance, you have to control the medical cost. There's, at the end of the day, the insurance is really just a way to finance the healthcare expense. And so if you pay, if you go more to the doctor and you pay more per visit, you get more drugs and you pay more per drug, the cost of the insurance is going to keep going up and up and up. And so we do have to address this, but I also think we need to be aware that they have hidden costs. They have the result of increasing time of explanation, of potential frustration, aggravation, and then maybe loss of retention or recruitment when it comes to dissatisfaction with employees. This is kind of a brief, again, I would say that this is actually like its own presentation. We are actually, as an association, the Healthcare Underwriters Association is going to do a full day on this topic. And so it is a massive topic, but I thought it at least made sense to just talk through how the dollar gets spent in the United States on healthcare and what that means to you. And then really what we're seeing as some cost containment strategies that can either help or hurt the experience or the return on investment. So this is really just kind of a glimpse, using a dollar bill to think about where your healthcare dollar is going. And so currently they're saying about 24 cents on the dollar is going to prescription drugs. When I started looking at this, it was 20 something years ago. That was closer to 10. 24 is actually low for what we see. It's getting closer to 30, even 40 or 50% on some groups of their healthcare spend is prescriptions. What's driving some of that is the high dollar medications, the $1,000 a month drugs for specialty situations. The GLP drug wave has compounded this. So there are big dollars going towards prescriptions. That is something that needs to be addressed. I kind of lumped the purple together, the inpatient, outpatient hospital services. About 40 cents total is going towards facilities. Again, you go back to the old days, people, the doctor came to your house, you didn't have prescription drugs, you didn't have really outpaid, you either went to the hospital or you didn't. And so the hospital cost used to be all the dollar. Now it's really down to 40 cents. And so that is something that, again, can be controlled mostly through price negotiation. And so that's something we'll talk about. And then you get into doctor's visits. And that is, I'll focus on the primary care side, preventative services. And then there's kind of this overlying thing on the whole dollar around catastrophic claims. And so some of the ways that people are addressing these costs on the primary care side, kind of thinking about how you go through the healthcare system, direct primary care has exploded. That is a situation where you have a direct contract with a primary care provider. So think about kind of like an affordable version of concierge medicine. And it's allowing people to get services, have a relationship with a doctor again. In my mind, this is one of those places where it can save dollars because it reduces prescription costs and inpatient, outpatient claims, and it improves the experience. So anytime we can lower costs and improve the experience is a win-win. When you talk about inpatient and outpatient, there's this concept of direct contracting. So that is going to, a specific hospital group and saying, hey, we're going to send all our members to you. We want a discount. And so that could be funneling everybody to one hospital, or it could be a plan option. So we're seeing several plan options now where you might have a direct contract as a choice, and then you could go to a traditional PPO network, but you're going to have either a lesser benefit or a higher premium. Again, that can add confusion, and so we have to be careful of that. But it also can reduce costs. And if you're already in that system, if that's the system that you prefer, it's probably a benefit. It's a win-win. There are all kinds of pharmacy programs out there. These are going to focus on trying to get the big dollar medications at a lower cost. So that could be going through manufacturer rebate programs, or actually importing drugs from out of the country, like from Canada, for a member. The way those programs usually work is you're going to have either low or no copay for the member if they choose to use that outlet. So if you're getting a $5,000 a month drug at Walgreens, the pharmacy benefit manager is going to say, nope, we have to talk to that member. And instead of getting it at Walgreens, we can get it for you here, and you don't pay that copay. You pay nothing if we are able to save the plan money doing that. All of these can create great savings. They can also create a lot of disruption, and so we're kind of having to balance this. I think again, these solutions can be great, but they have to be strategic. We don't want to jump into them with both feet because we got a bad renewal coming around the corner. That is very reactive. Now, proactively, we can start to introduce changes and slow the pace of change to your own organization's preference. So you can say, hey, I only have capacity to tackle this drug issue. Let's tackle that, and then we can start talking about different networks or direct primary care. And so by doing this piecemeal and in a proactive manner, it can be much less disruptive, and it can create really long-term value instead of devaluing the experience. Some of the things that we see as those hidden costs, repeated questions, corrections, coordination of vendors. I call it vendor ping pong, where you're just bouncing from one vendor to another, trying to get somebody to take responsibility for the issue. Payroll issues, onboarding, offboarding, life event issues, errors, just the processing alone. A lot of this can be addressed with integration. So this comes to technology and integration. Towards the end, Summer, I'm going to ask you to talk a little bit about the solutions that you guys have from a technology standpoint that can integrate some of these HR demands. So a couple things that I want to talk through that I think are things to put on your list, but really simplifying the plan options. Again, it's a balance between trying to control costs and customize, but the more that we can simplify this so that people understand what they have and how much they are going to pay, that is the key. So a couple options, depending on your group size. If you're a small group, 2 or 3 options is kind of a good cap. If you've got a larger workforce and maybe you need a few different network solutions, different areas, that can expand. But it has to be a very clear explanation of what you're going to pay if you get sick. That's what people want to know. Smarter pharmacy strategies. Again, some of that is around how the drugs are covered, the formulary. I think it's more important about the transparency. So having a tool that lets people know what they're going to pay. Also, people like to know what they could pay if they went outside the plan. So there's the kind of the Good RX world. There is the Cost Plus. There is Trump RX. There are all these programs where you can get discounted drugs. Sometimes those make sense versus running a drug through a plan, or for a drug that is not covered on the plan. The GLP example, a lot of times GLPs are covered for a certain condition, not for all. I do think that voluntary benefits can play a big role here to fill in the gaps. So you got a higher deductible, we can implement some voluntary benefits to backfill some of that out-of-pocket risk. And then really kind of designing this to fit your workforce. And so whether that's a deductible levels, the copays, or versus a high deductible or health savings account plan, a health savings account plan doesn't necessarily make sense in an environment where people don't understand the taxation or have a tax issue. In other environments, it's kind of a no-brainer to have that available for the people that are looking to minimize their income tax. And then again, the self-navigation tools need to be there so that people can help one find their own answers. Is my doctor in the network? Here's where the provider directory is. Here's the link to that directory. How do I find the best cost for this service? That's a healthcare advocacy tool. We have options that pair a lot of these tools together, where you can find drug costs, provider information, and plan comparison all in one tool. So where do we want to spend our time? Open enrollment support, not handling the whole thing, but supporting people in that decision. Onboarding new people, not just explaining the benefits. Again, if we have a video that explains the benefits, then you can sit down and support that instead of being the one that's providing all the information. Same with life events and ongoing troubleshooting. We want to have some access to self-service up front, and then if those don't get resolved, then they come to your desk, not you're the first stop. And then managing vendors, sometimes, again, we can customize a benefit plan by having 12 vendors in place, one for dental, one for vision, one for short-term, one for long-term, 3 or 4 vendors on the medical side with pharmacy, stop loss, all these different pieces. But sometimes there is a increased cost to managing more vendors versus bundling solutions and having a single point of contact, whether that's your consultant or broker, or maybe 1 or 2 less carriers to control that flow. A lot of this is going to be tied together with your payroll and HRIS integration. And so again, having a central hub is the key. We want to have one place where the information is stored, updated, and auditable, and then pushed out to carrier sites or the benefit admin system. And so again, I'm going to have Summer hit on that in just a few slides. Again, all technology that improves the employee experience, self-service, plan comparison, decision support, and then being able to get faster answers. I love using video here, the infographics. We are working on developing AI support tools specific to a group benefit plan. It is gotten to a point where the cost prohibition has come down to 0. And so you can have a chatbot that answers questions on your benefit plan, whether that's just for you or for a junior HR person or directly employee facing. So really cool where some of these solutions are coming from and how fast they're coming. So again, I kind of want to start wrapping up and start talking about what do we need to be thinking about doing to improve the experience. I do believe we're going to a point where we need to go to fewer options and better design, not more options. More options is not better. It's more sustainable to get options that are understandable, clearly educated. They have to be technology enrolled, related, and supported. And so, the days of paper are unfortunately coming to a very, very quick close. We still fight that fight internally and externally, but having strong partners on all sides, whether it's benefit, payroll, HRIS, benefit admin systems are going to all be the things you need to be focused on. I'm going to click through a couple practical next steps. Talk to your people and find out where the pain points are. Is it about the cost? Is it about the access, like we talked about? Are they having trouble getting to the providers? Are they having other issues? Identify on your team on the admin bottlenecks. Where are the where are the problems? Is it coming through open enrollment? Is it coming through onboarding? Is it coming through getting information pushed from one system to another? If the paper forms are coming in and they're going into the payroll system, are they getting back out to everywhere else they need to be? And then I always think about the complexity, how many vendors, how many products, how many plans, are there places that we can eliminate without impacting the satisfaction or possibly improving the satisfaction? And then evaluate what tools and partners you have at the table. I'm going to skip our little commercial. Again, I think this is really just how we structure our long-term strategy. But I want to focus on what challenges people are facing today, and where are your employees struggling. And that can be a discussion. Obviously, you can input any issues or questions in the chat. And while people are doing that, I wanted to turn it over to Summer and give us a little bit of higher levels expertise in that technology hub central space and how that fits.
Of course. So thanks, Joe. A lot of really great information. So when it comes to higher level and how we can assist with your benefits, obviously we're not going to have the expertise Joe has with those benefit plans and what they need to look like. However, we do have tools and resources to help you manage them. When he's talking about open enrollment and AI tools and connections with your brokers, I know so many of us have been there with open enrollment, and if you don't have a great process and a great system in place, it can be a little bit chaotic, understanding which plans are going to need to be there, keeping track of everyone to make sure that that enrollment has been completed and taken care of, what's their process. So we do have a really great HRIS tool that can really just be implemented with your payroll and with all of your HR processes, connecting to your employee portals through higher level. So that is with our HRIS platform, iSolved, that we utilize. And then it does work with, if you don't want to use the benefit piece within that, it does work with different brokers, benefit management pieces like Employee Navigator, things such as that, to really just help you manage it. Use those AI tools and make sure that your employees are getting the best information that they can, that employee messaging is consistent coming from you rather than a bunch of different emails. It can be right there all in the same place. We all know multiple logins is not fun. So keeping it under one umbrella, year after year, you think, oh, where was that enrollment information at? Oh, we were using a different system then. I need to go back and maybe pull that and make sure if you're trying to go back into your record keeping it all within the HRIS platform that you're already using for payroll, onboarding. That documentation really just kind of simplifies and eases that process. Now, Joe, I actually did have a question, or maybe it's just wanting further explanation. I was interested to see that the pharmacy piece was the largest part of the dollar of where the plan price is going. With the different supplemental pharmacy plan things out there, like the Trump RX, do you expect that to kind of take a decrease over the next few years, or do you see that piece continuing to grow?
Yeah, so the pharmacy over the last several years has been just kind of a hockey stick growth on the percentage of the inflation on prescriptions. I think the programs like GoodRx, Trump RX, Cost Plus, as Mark Cuban's those are all discount programs, and the cap that they kind of have is that they are not being run through your plan. And so if you're running a drug through that, it is not going towards your out-of-pocket accumulators, your deductible, or your max out-of-pocket. And so it works well for people that are just taking one drug or a few drugs, and they're not going to get their max, or they're using it for drugs that aren't covered under the traditional plan. So I think it can help, but I don't think it's going to solve the problem. I think there's probably honestly has to be some regulation or some intervention there to really slow down the drug costs, because the drugs that are coming out now, it used to be like $1,000 a month was something that would show up on our radar for a claims report. There's so many of those now that they don't even show up. It's like $10,000 a month drugs are what is causing alarm. So yeah, these biosimilars, the specialty class drugs have just, the cost is just it's unreal. So it's not uncommon to see $100,000 of drugs on a single member's claims reports.
So in the past, when we've kind of reviewed different renewals and rates, the understanding has always been that large claims maybe are what can cause increases in prices. But do you think it's the pharmacy plans as well and the prescription drugs others are using that are kind of creating that increase?
Yeah, absolutely. Yeah. If we look at claims reports for our block of business, 30 to 40% of those claims are coming straight from pharmacy. And if you get somebody on a really high dollar drug, that could be significantly higher. It could be 60% of the cost is just coming from drugs, or even a few people's drugs. So yeah, it is driving industry wide. It's driving the total risk. So if you think about it, if your group is relatively healthy, you're going to get an average increase, which has been 8 to 10 or 8 to 12%. Probably half of that increase is coming from drugs. If your particular group has really high drug utilization, there could be multiples of that. It could be 30, 40% because of a couple high dollar drugs.
Interesting. Very interesting.
Yeah, kind of scary.
I'm not seeing many other questions come in as of right now. We can give it a moment to see if anybody has questions that they would like to submit. Of course, Joe, we have your information we can send out as well with the recording. If anybody, kind of dwells on this and thinks after the fact, okay, I should have asked this question. This came to mind after I've heard. Since it is really great information. And, just because benefits is something we deal with a lot doesn't mean that the information is not a little overwhelming when you hear it. So it does take a moment to simmer and think about it and how it can impact each individual business.
Well, certainly appreciate the opportunity, and again, happy to stay on and answer any questions. And anybody that has questions offline would welcome the conversation. So thank you again.
We will send this recording out. It looks like Mark has a question. He's raised his hand. Mark, I don't think we will be able to unmute you. If you are able to throw it into the chat, we would love to answer your question, but I don't believe we'll be able to unmute you to ask directly. While we're waiting on Mark. Oh, is there a place to check drug price with insurance versus just going to GoodRx, etc.?
There are some tools out there. So they're paid tools. Some of them are app based, but they are like one that we use is called Fresh Bennies, and it will compare drug cost across platforms. So across like the discount programs as well as through pharmacy. So right now, though, without a paid tool, your best bet is to go to a couple sites. So I would go to either GoodRx, Trump RX, or Cost Plus. Cost Plus kind of focuses on the generic drugs. Trump RX is mostly the name brand drugs. GoodRx is probably the biggest cross section. And then if you go to your provider's site, you should be able to check drug costs there. The other place that I go a lot is to Medicare.gov. Medicare.gov will show the retail price for almost any drug. And so that will give you kind of a baseline to show, and it is sortable by pharmacy. So you can see what a drug costs at different pharmacies. But the tools are not terribly expensive. I think $10 to $12 per employee, I think, is what that tool is costing.
Do you ever see that people include that tool with their insurance plans, like as a benefit?
Absolutely. I think that like that particular one is one that we really like. It has a lot of those things we talked about. It has provider ratings and cost. It has drug ratings and cost, and then it does have an outbound health advocate you can talk to. So if you're going to have a surgery, you can talk to them and try to get some feedback on where you go with your plan. And then there's also an add-on on that plan where you can add on a mental health, a virtual mental health provider access at no cost. And so it is kind of, again, going back to accessing and utilization. That's one of the tools. There are others, but that one is kind of all lumped together, and you kind of get the best of information and support with access.
Yeah, I think accessing that information and really doing the research is probably something that a lot of employees struggle with. I know at higher level, we coach that to our team members. If you're going to have, a procedure or any sort of scans, maybe do some research and do some cost comparison to make the best decision on where to receive your services. But sometimes that is very hard for an employee to just go and research, and the providers not wanting to be upfront, or it's just kind of difficult to get that information out prior. It can be kind of burdensome for them.
No, I think it's a challenge. I think to having some tool to support is key. So yeah, I think that Fresh Bennies is one we recommend. That can be added to any plan. It's basically a standalone benefit at that point. You're basically getting a mobile assistant to help you navigate healthcare.
Mm-hmm. Interesting.
Good
All right,
question.
I don't see any other questions coming in at the moment, but as I was saying, Joe, we will send this recording out to all of those that have registered today, and it will come with the SHRM credit code if you are looking to turn that in for any continuing education. So, coming up in the next month or two, we have two really great high notes that will be airing soon. At the end of April, we will have a discussion over OSHA. And then May 13th, we will be having a live AI workshop. So looking forward to that. Registration links are already out there on the higher level webpage. Once again, thank you all for joining us today. Joe, thank you for being here. Great information as always. And I hope you all enjoy the rest of your day. Thank you.
Thank you very much. Have a good day.